Hi everyone, I'm Susie, the Administrative Assistant for Boise State's Genetic Counseling Program. Welcome to our virtual open house. We're really happy you're joining us. Our Program Director, Jen Eichmeyer, will be discussing the details of our program today, and our Assistant Program Director, Leslie Ortle, will talk about fieldwork and Capstone. So let's get started. All genetic counseling programs are regulated by the Accreditation Council for Genetic Counseling, which ensures that programs are meeting the highest standards available for training genetic counselors. We currently have a new program accreditation status with ACGC and will be going for full accreditation in a few years. Because of this status, we do not accept transfer credits, as we will need to report on our current courses during the site study for full accreditation. In addition to meeting ACGC standards, our courses also must meet Quality Matters standards. Quality Matters sets 42 standards based on best practices for high-quality online courses. Since we're an online program, we have to meet online standards. Lastly, the American Board of Genetic Counseling administers the certification exam for genetic counselors. This board exam confirms that individuals have met the standards for genetic counseling practice and provides guidance for the public in selecting qualified practitioners. Our courses and program learning objectives are built around the standards set by these organizations so that our graduates are prepared for board certification and practice. And now I will turn this over to Jen Eichmeyer.
This is a list of our program outcomes, which can be found on our website. These are very closely aligned with the ACGC practice-based competencies for genetic counselors, which are the 22 practice-based competencies that an entry-level provider must demonstrate to successfully practice as a genetic counselor. And these standards are assessed on the ABGC certification exam. We are a fully online program, which means all course activities are conducted virtually. Students do not have a requirement to travel to campus at any time during the program. We are primarily asynchronous, so all of the content is created upfront and released on a weekly basis. The weekly content is a variety of recordings, recorded lectures, readings, podcasts, and other multimedia sources. Since we are a new program, we don't yet have access to scholarships, although we are always on the lookout for those. But financial aid is available to cover tuition costs as well as temporary relocation costs for fieldwork. Our program is full-time. That means that we recommend students commit to at least 30 hours per week for coursework and fieldwork. We do not have a part-time option at this time. The program is 56 credits, 41 of which are online courses and 15 are fieldwork. Students do not have a fieldwork requirement until the second year, which starts in the summer after the first year. This is a pedagogical choice we made to enhance the continuity of the clinical experience and also provide enough background knowledge to have more engaged participation in the clinic. We do have a capstone project rather than a thesis, and we will go into detail later on that. We received the question of whether we are more psychosocial or science focused, and I would say we are both because our focus is really on clinical skills, which requires proficiency in both areas. How you could distinguish us is that we are more clinically focused rather than heavy research based. We've also built in more business skills and health policy into our curriculum, as that is now a very important part of clinical practice. So our program is focused on training clinicians. Our program accepts 12 students each year, and that's the way it'll stay for the foreseeable future. In addition to coursework and fieldwork, students also participate in supplementary activities. We have an asynchronous journal club between first and second years, as well as a synchronous monthly journal club with the GC students at the University of Technology Sydney program. Students also have an interprofessional educational experience with the Masters of Science in Respiratory Care students in the summer, and during fieldwork they engage in peer supervision conference to discuss clinical matters. I'm going to shift to talking a bit about online learning. It's important to consider your personal learning style when thinking about an online program. The content is very much the same as you would find in a face-to-face program because of accreditation standards, but the delivery is quite different and not everyone is suited for this kind of learning environment. With COVID, most students have now engaged or will be experiencing virtual learning in some capacity, but our program was designed before COVID, and so we have put a lot of intention embedded in everything we do. So in a synchronous setting, students are on a web meeting like we are here today and engage in real time. In an asynchronous setting, which is what we primarily are, this is more of a flipped classroom in which the content is provided up front and understanding of that content is assessed with various active learning activities. We employ active learning strategies in our teaching, which is a method that supports learning beyond recording and absorbing knowledge. Strategies include writing reflections, discussions, problem solving, all of which promote analysis, synthesis, and evaluation. Many of our assignments are small group or pairs, and within those small groups or pairs, students will get together live, usually by video, to work. We also work to create social presence and community. Engaging activities involve opportunities for interaction with course content, peers, and the instructor. And we measure how much of the course has student to student, student to content, and student to instructor engagement, and try to plan for a balance of these types of interactions. Students do both individual and group projects, which allows them to learn from each other as much as they learn from the instructors. And we really do encourage strongly that students use video as often as possible, whether that's between each other or with faculty, to continue to create that sense of community and presence. We do have virtual drop-in office hours where students can talk live to instructors on a weekly basis, which has been a very favorable activity in our courses. So, important characteristics of online learners include being both independent and collaborative. Students often have to be more self-motivated as they don't attend a classroom on a regular basis, but they also have to be accountable to that information for their peers as they will be relying on each other for assignments and engagement. This also means that students should have really good time management skills. We look for individuals who are self-reliant and can problem solve. In an online program, we aren't always immediately available, so being able to look for answers or solutions on your own first is an important part of being in an online program. Also, because we are a new program, we are offering a new experience, we do ask that our students be committed and patient and flexible. We are fully invested in their learning, but we also know that new things often need adjustments. So we are looking for individuals who are understanding and generous as we work these things out. I've actually been remarkably impressed with how this first year has gone. We've had relatively small issues, and most of what we have has been related to us learning the technology. And we've had some issues where we've had to make a couple of corrections to the learning management system. But there are changes that we're going to make as we go along, and this is actually no different than any other face-to-face program. If you talk to programs who've been around for 20 years, they'll tell you that they've made a lot of changes as they go along, and we will be doing the same thing. I think our successes are really evident in how well our students are currently doing in fieldwork. They are exceeding our expectations and really doing remarkable, and we're really proud of that work so far. So now I'm going to pass it off to Leslie to talk more about fieldwork and the Capstone project.
Okay, thanks, Jen. And good afternoon / good morning to everyone. I'm on Eastern time, so it's afternoon for me. I am the fieldwork coordinator for the program, and so I work with students to help place them into clinical rotations that, as Jen mentioned, start in second year. Boise State has 3 academic terms. Each of them is 14 weeks long, and they take place in summer, fall, and the following spring. So we put our students into 3 long core rotations. This is different than some programs that may do up to 10 much shorter rotations, and we made the decision to give students the benefit, I think, of that long-term continuity in clinic. Each one is We have a goal of 210 hours in clinic, and that can be over as few as 7 weeks or up to the full 14 weeks, which is about 2 to 4 days a week. The specialties we cover, we aim for what you may hear described as the big three in genetic counseling, which are prenatal, pediatrics, and cancer. And this goes back to those ABGC competencies, the practice-based competencies that all genetic counselors are expected to have. Although we do have some opportunities for shorter elective rotations, as well as other rotations that have functioned as the core ones, but have been in areas such as general adult genetics. Most of our rotations are in person and intended to be in person. With COVID this year, many of them switched to remote for the summer, so most of them are transitioning back to in-person for the fall. That being said, there is the opportunity for some remote rotations to take place. And as another part of the ACGC standards is making sure that students have exposure to more than one mode of delivery. So not only in-person genetic counseling, but also telehealth, on the phone, group counseling, other methods. That's now required. So that has been built in from the beginning. Jen, if you could go to the next slide, please. All right, and this is a map to give you a general idea of where our rotations are. We don't have necessarily the same sites from term to term, even from year to year, but the states that are colored in orange are reliable, confirmed rotation sites. These have clinics that have committed to working with us and taking at least one student per year. You'll see that there's a pretty heavy concentration in the Pacific Northwest, but also there's opportunities in New Mexico and Alaska. In blue, we have sites in states that we currently have arrangements with. They may not continue into the future, so I've put them down as a possibility, but not yet confirmed. And going back to what Jen was saying about flexibility, that's a really important part of this program and a really important aspect of the fieldwork component is that flexibility to be able to travel and to be open to perhaps going somewhere that's more distant from where you live. And next slide, please, Jen. So selecting the clinical placements of who goes where. I have multiple meetings with the students throughout the first year, and this is something that as we've worked with our first cohort, have refined this process a little bit, but we also had the surprise of COVID this year. So it went, I thought, actually very well, considering that we all of a sudden had a lot less clinical availability to work with. But we're expecting things to still be not quite back to normal this year, but perhaps a little bit more smooth than they were last year. So I'm going to be continuing to work with the first cohort and then our new second cohort who are first years and start talking about their first placements this summer as we go ahead into the new school year. Prior to actually completing the field work, early on in first year, there are exercises in the coursework to help students with budgeting and planning exercises. This is because we really want students to understand that they're going to be expected to travel. In most cases, students are going to have to travel for one, if not two or even all three placements. Again, this is for anywhere from 7 to 14 weeks, so it's a temporary relocation, but it does require that flexibility. We're working, again, to put students in areas that are convenient for them. However, we want to make sure you get enough exposure to those three specialties and also experience some of the diversity in practice styles, in patient populations, and I think other benefits that you get from traveling in different parts of the country. Okay, and I'm going to switch over to the Capstone project. As Jen mentioned, we have a capstone project rather than a thesis. What this means is that you will learn strong research methods and have strong foundational research skills that you're taught as part of your coursework. They can be applied to a more traditional research type project. However, we highly encourage and are very open to a practical application. And as I've been working with students in the first cohort, they've had some fantastic ideas. I'm going to describe those in a minute, but looking at projects that are research informed, so still based on evidence, using the literature, using expert consultation to develop something like a practice tool or a resource that will fill a gap that's been identified for patients, providers, or others. So for some examples, they're on the next slide. So these are a few of the things that our current students are working on. One is a culturally tailored and also intentionally low-tech tool to help encourage family history gathering among a population where this has been identified as a need. Another one is a little bit more high-tech, and it's actually a design for an app to help family physicians refer the right patients to cancer genetics and actually assist in generating referrals to help avoid inappropriate or even missed referrals. Another one is a curated online resource, basically a website for people who are adopted or donor conceived and who are interested in learning more about themselves and their own genetics, whether or not they want to connect with biological relatives. And another one is a web-based videos to help teach genetic counselors some of the essentials about American Sign Language when they are working with patients from the deaf community. So even if they're working with an interpreter, what are some of the key communication essentials that may help them build rapport and have a better experience. So as you can see, all of these they require a lot of research, a lot of planning. There's a lot of traditional research skills that go into it, but it's the final product is not necessarily going to be a manuscript, but it's going to be an active tool or guide. Okay, I'll hand it back over to you, Jen.
Thanks, Leslie. So let's talk a bit about our approach to admissions. We get a lot of questions about this, and much of the information is again on our website, and we do provide a guidebook with explicit instructions for applying. So first, our requirements include a personal statement, a CV with documented experiences of skills relevant to genetic counseling, letters of recommendation, and transcripts with required prerequisite work. We have very specific prompts for the personal statement, and we allow for 4 pages to address those, and we have a longer personal statement on purpose. This allows you to have more space to tell us who you are. Having a sense of the applicant is very important to us, and it's an important part of our evaluation process. So really try to use this space to your advantage to tell us about yourself and your skills. You have the opportunity to showcase yourself through the personal statement, and it's really up to you to figure out what elements of yourself you want to highlight. I would also recommend that you are meticulous about following the directions. Don't go over the allowed page limit. Look at the guidelines for font size, spacing, and margins. We are paying attention to how much you are paying attention to details. So make sure you're paying attention. We don't require the GRE, and the reason is that the literature does not support that this exam speaks to success in graduate school. Your transcripts will be provided to us with your coursework and GPA, and GPA is a factor we review, but the grades on the specific courses that we've designated on the website are much more important than the overall GPA. We will absolutely review applications with lower GPAs if there are additional letters of reference that can speak to academic aptitude. We know that a GPA does not necessarily represent you or your abilities, but we also want to know that you can be successful at the graduate level. So if you have one of these GPAs that is lower, I do encourage you to include a narrative about that in your personal statement to explain how and why it is what it is. And all of this is really part of our holistic approach to admissions. One piece does not tell us who you are. The last part of this is about skills relevant to genetic counseling, which I want to emphasize, this is not the same as shadowing. We actually don't require shadowing experiences, although we do encourage it. This is not the same for other programs, so you will need to look at each program's specific requirements. What's important to us is that we want you to be able to articulate what the profession is, know what the profession is, know that you want to be part of it, and why you personally are a good fit for it. And you don't necessarily need to have a shadowing experience to get to that. We got a lot of questions about what to do for alternative shadowing in this COVID era. And I don't have a lot of great advice, but there are telehealth genetic counseling companies and there are industry genetic counselors who could be willing to help. So you could reach out to those individuals. You can look on nsgc.org to find out who those people are, and that might be something that would help you with your shadowing experience. But again, shadowing is not a requirement for our program, so COVID would not impact this component for us. We do require advocacy or volunteering, and we very much encourage experiencing populations different from your own. Those will all help to inform your personal statement. But we are very much aware that this could be limited because of COVID as well. And so do your best. Get those experiences as best as you can, but know that we are taking this into consideration and we're very much aware that that is something that's going to be difficult this year. And again, if you'd like to include your narrative of your attempt to get those experiences and why it didn't work or what you learned about it in your personal statement, those are all things that help us get to know you. And then the last thing is get your national matching system match number. The NMS number is really, really important. And again, this is attention to detail. If you don't have that number on your application, you won't be passed on to us for review. So get your NMS number. So our interviews are conducted virtually. They always have been. We've gone through 2 rounds of this now. We typically invite 45 applicants for interviews, and we use these candidates for our rank order list. If you are invited for an interview, it will consist of several interviews with me, other leadership, committee members, and current students by video meetings. There's also a group interview with other applicants and an introductory video that must be submitted prior to the interview date for the interviewees. Again, we will provide very specific prompts, so address all of those, pay attention to the guidelines, pay attention to the time limits. And I know face-to-face programs don't require that you create a video, but we are a different kind of program, and we do require it because there are many activities in the program that involve video work. Plus, it saves time during your individual interview of introducing yourself and answering the same question several times. So that's what we wanted to cover in terms of most of the questions we received. We're going to take a few moments to address some of the remaining questions that didn't quite fit into the flow here. So I'm going to switch over my screen. Okay, so for those with limited bandwidth this fall, what's one activity that would best prepare and position us for the Boise State program in application evaluation? I would say that there are 2 things. If you're able to be in an online course, I think that would be very helpful. As I said earlier, online education is different. A lot of you will have had this experience now, so being able to speak to that and make that comparison and do some of that self-reflection of who you are and how you fit in an online program would be helpful. The other thing that we look at is we really try to look at individuals who have made an attempt to be exposed to different kinds of people. Typically, we're asking for you to have some sort of experiences with populations that are different from your own. We understand that that's something that just might not be possible this year, but there are ways to do that through some advocacy work. If you can get in touch with genetic counseling support groups, find ways to try to help support some of these organizations. That may be a way that you can get those experiences. Let's see. We got a lot of questions, and I'm just going to kind of summarize these questions about our curriculum and how it addresses ethnic, race, gender, cultural issues. Again, we've been very intentional with the program. Part of the reason we started this program, and we did it in the format that we chose, was to increase access to genetic counseling as a profession to populations that generally don't have access. That could be people in rural settings, people who don't live near academic centers, people who don't have access to medical schools. So our main goal is to really open up that access so we can bring some diversity to the profession. And we're already seeing that with the cohorts that that we have matriculated so far, is that we do have a good degree of diversity with our students. We have at least 6 classes where we've embedded different modules and activities related to cultural issues. Some of these activities are with the students themselves, and some of them are asking the students to go out into their community. We do a lot of self-reflection. We have implicit bias training built in. There's a philosophy that we have that cultural competency isn't something that you do in a single class. It's something that you do throughout the entire program. So when we're talking about health disparities and social determinants of health related to healthcare policy and insurance, that's embedded in that content. So we have sprinkled that throughout all of our curriculum. Is there a big difference between genetic counseling programs housed in medical schools versus not? My personal opinion is no. I went to a program that was housed in a medical school, and I did take classes with some of the medical students, but I don't think that there really was a difference. Now, that's our opinion, and probably if you talk to programs that are housed in medical schools, they will think there is a difference, and that's totally fine, but my opinion is no. Let's see. What's the largest change I've seen in the field in the last 5 years? We are very much moving towards genomic medicine as opposed to single gene, which is something that was really prevalent earlier in my career. And now that we have newer technology and we have access to this information, I think genomics is really where we're moving forward, and genetic counselors can definitely be a part of that movement. I also think, and I hope, that genetic counselors start thinking more globally, again, related to genomics, in terms of being embedded more in general practitioners. I think there are a lot of people who can benefit from the kinds of services that we have to offer. So internists and general practitioners, I think, could have value add to their services if they had a genetic counselor involved in their program. Let's see. Leslie, I think I'm going to turn the rest over to you.
Okay, thanks, Jen. So we have a lot of questions about fieldwork, which is understandable considering that our model is a bit different from other programs where you're face-to-face and generally staying within the same city, although there are several face-to-face programs now that are incorporating traveling for fieldwork as well. So one of the questions is, what changes, if any, does the program intend to make due to COVID for this year and years to come? I spoke a little bit about this before in that we switched to several remote rotations where students are connecting, seeing patients, meeting with their supervisors via Zoom, using a VPN for chart access. There was some uncertainty about whether these would be feasible and go forward. I think it speaks to the quality and commitment of our clinical supervisors that they pushed really hard to make all of this happen. And now we have a precedent set so that in areas that are affected by future waves of COVID or additional lockdowns, public health requirements, there are more options now to go virtual rather than having to travel in person for most of our sites. Is there a place online that I could find your clinical rotation sites? And the answer is no. It's not that we want to be secretive about it, it's that there are frequent changes. I think reliably in Boise, there are always going to be spots open, but for reasons that even before COVID, genetic counseling, some genetic counselors work at large academic centers with very big teams, but a lot of them are essentially solo practitioners within a hospital, and they are affected by things like maternity leaves, or they can't take a student the entire year because it's a lot of extra work on them. Staff changes, especially in rural areas. It can sometimes be hard to maintain a full staff, although we're hoping to help change that landscape a little bit with our graduates. So I just tell people to understand that we do have a focus on the rural West, especially the Pacific Northwest. We occasionally have opportunities in other states. We don't foresee adding too many other areas, but sometimes opportunities come up for a limited time, like a year or part of a year, and then they're not available anymore. So it's really, it's not a static list. For a number of reasons, but we do always end up with enough spots. So there's redundancy built in terms of numbers to make sure that everyone will have enough opportunities to train. Is housing offered through the program, or do students find their own housing? We don't offer housing, although some of our supervisors and contacts at our clinical sites may have recommendations, such as they may know of medical student temporary housing that may be available, or for nursing students, and they've offered up these contacts for students to investigate on their own. And this goes back to those exercises and coursework. We have students sit and look at, what would the cost be? What would I need to do to find housing for, say, 8 weeks somewhere? Or, start looking on Craigslist, workout transportation. So it is up to the student to find their own housing, but we provide support and guidance into how you would go about doing that. Okay. And then I have questions about, are there any specialty rotations? So we do have some rotations that are, I'd say, would be considered specialty. We've had a couple students do adult genetics. In general, we aim for everyone to have a core rotation in prenatal, pediatrics, and cancer, though again with COVID we've gotten extra flexible. And we're certainly open to opportunities as they come up. One area where we do have some specialty opportunities is with our telehealth providers. Those opportunities, these are through private companies that provide telegenetics. They typically are looking for more advanced students who are closer to graduation, who've done something, say they've already done a full cancer rotation, and they're going to spend their telehealth rotation focusing on sort of a subset of cases, such as patients who are only having post-test genetic counseling and focusing on a skill set in that area. We also have a number of non-clinical rotations, and these can vary in length from anywhere from a couple of weeks to, I think we've had some that have been about 8 weeks. And these are in industry. We have some in advocacy and nonprofit, also in labs, and potentially one in public health. And these also, we have more becoming available all the time. And we're also sharing them with other programs, so they're not necessarily available at any time. Let's see. Is there anything else? Okay, I think we can move to the chat questions now. Jen, can you see the chat? You're muted.
Okay, is financial aid or relocation assistance awarded by need, or do you have to apply? So you would have to apply for it. You would have to build that into your financial aid request when you were putting it in for your tuition. If I can't oh, do you want to take the next one?
Oh, yeah, I thought I would take that one. So if I can't relocate because of children, does Boise State not work for me because of rotation locations, or can I create my own rotations in my state? So I will note we do have several parents in our program, so it is possible to do this program with kids, but there are other factors to your circumstances that are going to affect that as well. So there is some flexibility to be able to relocate that is needed. So I think even for students who are, say, who live in Boise, we expect them to relocate for at least one of those 3 rotations, if not 2 or more. As far as creating your own rotations, this is not something that we do. We've worked a lot over the past few years to develop relationships and arrangements with clinics that are committed to working with us long term and are also available to us. There are many genetics clinics across the country. A lot of them are involved with other programs, especially face-to-face programs that have local needs for students who are not expected to travel and did not come into their program, ready and having the means to be able to do that. So we want to be very collaborative with and respectful of other genetic counseling programs and their needs. So we don't look to students to create locations in their own areas. Let's see. I think I spoke to the specialty areas. That was another question. Are there rotations that would be in Spanish or different languages? We do have one rotation site right now that is with a bilingual genetic counselor, so she counsels in Spanish and in English, and so this is open to bilingual students. We've been looking at more opportunities in this area. They haven't come to fruition yet, but it's something we're very much open to. As I know, we have in our first cohort, I think we have 3 or 4 Spanish speakers. Are there available housing locations? So I think I spoke to students need to find your own housing, but some options are looking at Airbnb, short-term rentals, not necessarily having to buy a house, but it's part of that planning and looking at traveling for short term, so 2 to 3 months at a time, and how you would plan for that process. Is there an opportunity to learn about psychiatric genetic counseling via rotation? And this is my specialty in my very small private practice. And right now, there is not. I would love for this to be an opportunity at some point in the future. Because of my job as an assistant program director, I keep my practice very small, and I don't have the capacity really, to have students observe those sessions right now. There is a competitive rotation at the University of British Columbia at a clinic called the ADAPT Clinic. Every summer they take at least one, if not a couple, of genetic counseling students through a competitive application. So that is something that people might want to look into if they wanted to get exposure to that. Okay. Do you want to do the next one, Jen, about second-year applicants?
So for us, what we would like to see is probably some self-reflection in the personal statement. So talk about what happened when you didn't get in, talk about how that impacted you and how you decided to move on and grow from that. We really like to see that, that transition from where you were to where you are now. And I think just owning it and putting it into your personal statement will also be something that will help reflect positively on you. So we don't need any more references. Put it in your personal statement.
All right. Is it possible to do a small rotation in adult genetics? Possibly. It depends on what we have available at the time. Right now we do have a rotation in adult genetics, but I'm not sure how long it's going to be available. This might be something we could arrange through telehealth. It would be something that I would want to, if a student was interested in that area, to let me know during our meetings to keep an eye out for, and see if it's something we can arrange. But it's not a typical part of what we have set up for our rotations. Another one is relocation only necessary for the 7 to 14 weeks of the clinical rotations. Afterwards, would we be able to return to our home state? Absolutely, yes. As long as you have an internet connection where you can do your coursework and your other work, there is no need for you to be living in the same area of clinic when you're not in clinic. So yeah, we have students all over, including one who's in Europe right now, and that's just fine, as long as you can deal with the time zones. In Vancouver, it's not Janine Austin. She did found the clinic, but it's run by a couple of other genetic counselors now. So it's going back to the psychiatric genetic counseling question.
And what's the average GPA of the students admitted? Honestly, I haven't looked. That's not something, it's not something that is heavily weighted factor for our program, so it's not something we think a lot about. I'm sure Susie and I could go back and look and see what the average GPA is, but again, the emphasis for us is really who you are, not necessarily the metrics like that just tell us a number. And that's all we have.
Yeah. Unless anyone wants to fire off another question into the chat box.
All right, well, thank you all for coming today, and if you have any other questions, please use the email that was provided and we will comment. All right, good luck to all of you. I know this is very
Yes.
stressful. Take care of yourselves, wear a mask, do all those good things.
Yes, good luck to all of you. And yes, the recording will be posted, but it might take a couple of weeks to get it up there because it actually goes through accessibility and will need to be captioned first. So patience.